So here we are going to focus one of the personality disorder. It is called dissociative disorder. Dissociative disorder, it is involve the problems with memories or identity, problems with emotion or perception, behavioral problem, and also sense of self. Dissociative symptoms can potentially disrupt every area of mental functioning, right? So dissociative disorder, one type of personality disorder, right? So what they said, it is a disruption in integrative function of memory or consciousness or identity. Dissociative disorder associated with exposure of any extremely traumatic events. So if you ask me, what are the underlying causes to develop dissociative disorder or risk factor? When we take the history from the patient, we can get patient will give you the history of child abuse or a long term undergo extreme stress, and the patient usually aware about the dissociation or separation. So they said patient exposure for a long time with extreme stress or they have any traumatic events in their life. So dissociative disorder, basically two types. One we called depersonalization or derealization disorder and dissociative amnesia. So let me recap it. So dissociative disorder is a personality disorder in which the conscious awareness become separated or we call dissociated from previous memories, previous thoughts and feelings. So patients have a two distinct personality in the same time, right? So what they said about this? The first one, they talk about the dissociative identity disorder, formerly called multiple personality disorder. So when a person exhibit more than one distinct and alternative personality, we call dissociative identity disorder. So what is the explanation? So one person but two personalities. So two or more fully developed, distinct and unique personality exist within a person. So original personality is different, the new personality change, and patient deny the original personality. The host is the primary personality, means which is the original personality, and the other personality are referred to as altered. Altered personalities may take full control of the client, one at a time, and may or may not be aware of one another. The altered may be aware of the host, but the host is not usually aware of the altered. So the other person can find out the problem, but the person are not aware about their behavior. So what are the data collection about the dissociative disorder? So the client may have an ability to recall the important information, right? Also, transition from one personality to the other is related to stress or traumatic events. So dissociation is usually as a method of distracting or defending oneself from anxiety and traumatic experience. So usually patient feeling of detachment from one's body environment. Hmm? So now go, what is dissociative amnesia? So the person who diagnosed by dissociative amnesia, they lack of memory regarding the personal information, and that is triggered by traumatic events. So what they said, when a person may block out the specific information or have no memory of particular events. So we said lack of memory regarding the personal information that is triggered by traumatic events. So what is their explanation? The inability to remember important personal information because of provoked the anxiety or memory impairment may range from partial or almost complete. The client may assume the new identity in a new environment and may drift from place to place or develop the new relationship, then return home unable to remember the past, or amnesia means forgetfulness. So data collection about dissociative amnesia: localized, selective, and generalized. Localized means the client blocks out all memories about the particular period of time. Selectives, the client recall some but not all memories about the specific period. Generalized, the client has a loss of all memory about the past. So here they said a little bit more about the deep personalization, or we call derealization disorder, an altered self-perception in which one's own reality is temporarily lost or changed. So patient feeling of detachment from one's body or from environment, but intact the reality testing. So what are the intervention or nursing care? So develop a trusting relationship. So when we talk to the patient, we should introduce ourselves, who I am, then make a good trustable relationship. It is our ethics of principle. Encouraging a verbal expression of painful experience. Why they are under anxieties, tell them to speak out. Verbal emotion, share with you, or also the concerned, why they're concerned, what are the extremely cause or their history about the child abuse. explore the method of copying, because everybody's copying mechanism is not same. Identify the source of conflict. So it is the underlying cause of disease. So we help the patient make a decision during the dissociative period, because this time it is difficult for your patient make a decision. So we help them. We encourage use of grounding techniques, and the grounding techniques is different for individual patient. So we have to decide which one the best for my patient, like clap handings, touching object, we call grounding techniques. What else? Focus the client strength and skill. Also try to orient the client with the environment. Provide the non-demanding and simple routine tasks. Allow the client to progress at his or her own pace. Also, implement the stress reducing techniques, because the extreme stress is one of the underlying causes of dissociative disorder. Also, we have to plan for individuals, group, or family psychotherapy. Hmm? Because the patient who have mental illness, they are inability to cope with or manage the stress. Hmm? Because it is very difficult for them to coping. Hmm? Because that disorder affect their mood or behavior. So always we have to follow therapeutic communication, not for block of communication. Integrate the dissociative aspect of personality or memory, and also expand the self-awareness.